In the previous video, we talked about what a muscle strain is. In this video, we're going to talk about ligament sprains. A sprain and a strain are both classified as tears. A strain is a tear in the muscle and a sprain is a tear of the ligament. A ligament's role is to stabilize the joint by limiting the amount the joint moves. A sprain to the ligament is suffered when the joint is forced outside its usual range of motion. Two of the most common injured joints are the ankle and the knee. They are usually injured during sport or in everyday life, such as stepping on a crack in the pavement. As with muscle strains, ligament sprains also have a grading classification system. A grade 1 sprain is minor structural damage to the ligament. Grade 2 sprain is a partial tear of the ligament, and a grade 3 sprain is a complete rupture of the ligament. Symptoms after a ligament sprain can include swelling and bruising, pain and weakness in the joint instability, loss of function, for example, not being able to put weight through the joint or not being able to use the joint. Typical healing times can range from 3 days to 3 weeks for a grade 1 sprain, 3 weeks to 6 months for a grade 2 sprain, and 5 weeks to 1 year for a grade 3 sprain. The same factors affect healing time for ligament sprains as with muscle strains. Rehabbing well after a ligament sprain is very important. You are more likely to re-sprain a ligament if it has already been sprained, and this risk is greater if rehab isn't performed adequately. Before you start rehab, you need to make sure you haven't suffered a fracture. After you are sure there is no fracture, we want to use the peace and love protocol to properly get the ligament back to full strength.